Okay, I think we can get started. So a huge thank you to all of you for joining us today. We're really looking forward to today's session where we are going to be deep diving into Korea's market access landscape for digital health solutions. So you can see today our experts who join us who will be discussing the Korean government's efforts in digital healthcare. So new legislative efforts, health technology assessment, and recent developments in areas like telemedicine and digital treatments and therapies. So today we're going to start with a presentation and then we will move into a panel discussion. And we're really pleased to have on the panel with us today representatives from both APAC Med and KMDIA. So we will try to leave some time at the end for Q&A. So I'll ask that you please type your questions in our chat box as we go through. And should we not get the time to address them all, we'll capture them so we can follow up with you afterwards. So without further ado, I would like to introduce Christine Nam. Christine is a foreign attorney at Kim & Chang based in Korea. And we are very thankful to have her with us today as our presenter and also facilitator for our panel discussion. Thank you, Christine, for joining us, and over to you to get started.
Thank you, Georgia. Thanks again for arranging this wonderful seminar for both the KMDA members and the APEC members. This is actually quite opportune because our KNC just recently launched our digital health team. And plus, in addition to that, I think we are personally feeling the need for digital health and et cetera, especially in light of the COVID and circumstances and environment where people are realizing that there's a much service that could be offered that is covered by digital health industry. So again, Georgia, thank you so much for arranging it and inviting us and giving us the opportunity to give this speech or the seminar and arranging this wonderful presentation. So I will share the screen and here we go. All right, so the presentation today is called Digital Health in the Regulatory Environment in Korea. Before I get started, I always ask quick questions. And I obviously, this is a virtual seminar. It's always difficult to ask questions. But I think I'm going to throw it at you that if you think about Korea, what are the two things that you could think of? And I know there's a lot of audience joining from Korea. And since I can't get the answer, I'll ask and answer myself. The two biggest, aside from BTS, who's like an awesome singer, singing boy band, but it's health, it's biotech, and also technology. So Samsung, LG, etc. Korea is one of the most wired country in the world, and obviously the Korean government has been pushing for and supporting biotech and pharmaceutical health industry in Korea. So it only makes sense that you marry these two concepts and voila, the child is the digital health care. So it is obviously, the government is very interested in this field and something that we should all be, keeping an eye on and monitoring as to what the developments and current status in Korea is. So hopefully by the end of this presentation, I could provide you with 3 big points. So people say that the good presentation only provides 3 good points, and if you do the 4th one, typically you forget. So the 3 big points I would like to offer that you would take from this presentation is that number 1, the current state in Korea, the regulatory state, is extremely strict when it comes to digital health related technology and products. However, number 2, the government is definitely understanding and feeling the pressure, and also is aware that there's a need to relax some of these regulations in Korea and to provide an environment that is more supportive of these digital health technologies. So that's number 2. Number 3 is that we're going to provide you with some examples and mechanisms that you could actually use and utilize in Korea to bypass or accommodate some of these hurdles that you will be facing as a manufacturer who are producing these products, or companies who are thinking of expanding their portfolio into these industries. So the government's effort, as I said, yes, the current status is that it is extremely strict. For example, a lot of the telemedicine type of technology is more or less prohibited in Korea, partly because all medical services are only allowed to be provided by healthcare professions. And as we all know, telemedicine would require other, practitioners, not just limited to healthcare professions. Again, we will go into more details about this. And so the government became aware that, the environment was not, accommodating for a lot of these new technologies to flourish. So one of the, as their fourth industrial revolution, they provided a mechanism that some of these, the companies could utilize to bypass or overcome some of the hurdles. And one of the mechanisms is called regulatory sandbox. And specifically what regulatory sandbox does is it provides a mechanism for companies to provide their products to the market without going into the typical standard approval processes. So it's slightly separate from this, actually, the topic that I'm going to show you. So the slide here explains the typical regulatory process a medical device would go through. The average time or the minimum time is that it takes about 520 days, which is more than or close to 2 years. So initially, you would apply for a approval for the medical device to the MFDS. Then you get an assessment whether this pertains or it qualifies to get a payment assistance for insurance purposes. And then you are evaluated, the technology is evaluated based on whether there's any side effects. Typically, these are data that's generated through clinical trials. And lastly, if you go through all this process, you could register through the insurance system to obtain the supplementary or the assistant payment. So we can call it reimbursement. So you can see that this third stage here takes about 280 days, which is about a year. And so what the government has proposed is, look, for certain types of technology, in this case, typically it's for ex vivo. So it's not actually devices that's implanted into your body, but it's sort of the in vitro testing assay, that type of technology. When it comes to that, what the government has offered is that you could provide this pre-market, but do the evaluation post-product, so post-market. And so it pertains to this step 3 here. This is a quick depiction as to the type of guidelines that Korean government has proposed so far from 2013 to present, and it relates to a lot of the digital health related technology and products. And then the bottom part here depicts the guidelines provided by the US. And what the take-home message from this is not to go through individual guidelines, but to give you a snapshot that Korea is actually, when it comes to digital health related guidelines, that it's actually on the leading, it has proposed even before the FDA has done. Traditionally, FDA has been the leader when it comes to providing guidance and regulatory schemes and et cetera, related to healthcare in general. But when it comes to digital health, Korea is definitely trying to step up and trying to be on the leadership position here. Again, this is the same type of information, but guidelines that is germane to the digital health industry. And so specifically, we would be discussing these two guidelines in more details in the later part of the talk today. This slide briefly explains what a regulatory sandbox is. As I said, regulatory sandbox is a way that company could somehow bypass some of the hurdles that they would encounter when they're trying to release certain products in Korea. So as in, it's very busy, but I'll try to explain this more simplistically by giving you an example. So let's say if there is a watch that is considered as a digital health technology. And so let's say the watch requires some sort of a telemedicine type of services. Now, what this regulatory sandbox does is, as you know, Korea, you could get approach the agency who's responsible for reviewing your product and get their opinion. However, what regulatory sandbox does is that it is a communication between one agency and another agency. In this case, the Ministry of Science once they get an inquiry whether a certain product is eligible to go through the regulatory sandbox, let's say it's a watch, they would contact the MFDS, who is the pertinent agency who will be reviewing these type of products, right? And they would ask, hey, MFDS, is there any regulation that would prohibit this specific watch to be launched in Korea? The MFDS is required to respond to the Ministry of Science within 30 days of the inquiry. Now, if they do not provide an answer within 30 days, the product would go on to the market. So basically, it is a very strong, mechanism for a company to utilize, or kind of piggybacking on one of the Ministry of Science, so that they could help achieve your final goal. So if there is no regulation, then it goes onto the market. Let's say there is a regulation. So the MFDS comes back and says, look, there is a prohibition, or there's a statute that says that you cannot release this product to the market. Now, depending on then the agency would interpret the statute or the law that is prohibiting this product, and they would see if they find it to be ambiguous or unreasonable of that such prohibition, then the agency would provide a temporary license to the product, and the product would go on to the market. Now, in the meantime, within 2 years, the agency would be forced to amend the statute, and then basically, after the statute is amended, because there's no prohibition on the product, the market would release as an official license, right? Now, typically, if there's a interest group or some other pressure where they don't want to change the statute, and changing the statute obviously is a big burden on any government agency and the in general. So what would happen is that instead of going through the temporary license pathway, what they would do is they would provide an exception to demonstration. So what this does is that you could release the product in a limited region for a limited time, typically 2 years, so that you could accumulate more clinical data and support to show that your product is worthy of being released to the market. And during that time, it will be bifurcated into 2 types of processes, where one is to eventually amend the statute, where if the statute is amended because there's no provision, the product will go onto the market with an official license. If not, it would remain as a temporary license, and then you would continue to collect more data on the product. And also there's a way, and you would consider whether you could amend the statute or not. And basically this is a delaying process. You would, after 2 years, you could, if after evaluation, some of the product, the agency could decide like, look, this is not, you can't really release it because X, Y, and Z, and then that process might be terminated. In another case, you could get another extension of 2 years to extend your temporary license. So again, that's the gist of the regulatory sandbox. Now, is this some just, theoretical, hypothetical, where you don't really have, no one really utilizes? That's actually not the case. About 364 cases up to the end of last year has been utilized in this regulatory sandbox, and they were releasing some of these products as through a temporary license or over the process that we explained. These are type of products that falls under financial innovations to smart city type of products. The orange ones are 2 products that I believe our audience would be interested in hearing more about. Huino's heart disease management services using watch type electrocardiogram devices. This was allowed as an exception, and it's currently collecting more additional data to show that it could be launched on as a temporary license in Korea. This decision was made in 2019. Similarly, NeoFact company has released a device for a home rehabilitation training device. Again, this decision was made in 2019, currently collecting additional data. Now, going to some of the current issue, and I believe this section is what most people are interested in to hear. There's going to be 3 types of points that I would like to make. As I explained, the entire medical the process is that it divides into 4 different stages. Number 1, you get approval for the device specifically. You need to ascertain whether the product is worthy of perhaps getting a reimbursement. Number 3, you look at, you're not evaluating the technology specifically, but you're evaluating whether there's any safety concern, looking at the clinical data and whether if you have sufficient data enough to release this, to obtain reimbursement for this product. And lastly, to obtain reimbursement, it seems very redundant, but you need to go through another evaluation where you register for reimbursement. And so the talk would be divided into these 3 points. Again, the same types that I've explained, divided into 4 stages. And then we also discussed briefly about the regulatory sandbox, where typically it is some of the devices that have gone through all this process, arduous process, but then you have another regulation that prohibits it from actually being launched. And that's when you utilize regulatory sandbox. So Medical Device Industry Act, what that proposed is that so basically a company who is trying to obtain approval, you could obtain approval as either a breakthrough medical device company. So you get a certification that you are a breakthrough medical device company. Now, what it does is the certification is valid for 3 years, and you could get an extension for every 3 years. Now, the benefit, there must be a benefit if you're trying to get a certification. There's a lot of benefit. For example, once you are designated as the breakthrough medical device company, you could participate in state R&D projects, a lot of benefits from tax reduction, exemptions, and other constructions, research facilities, and et cetera. So there's a lot of good benefits when you become a medical device, breakthrough medical device company. Now, commonsensically, if you're a big conglomerate with a lot of cash versus you're a startup, obviously it would be unfair if you're making both companies, two very different companies to compete for the same certification, right? So there are different categories of classification depending on how big you are, and you have to meet different requirements to become a breakthrough medical device company. Now, if you are a breakthrough medical company, if you produce any product, does that make a breakthrough medical device devices? Oh, sorry, before I get into this. The next slide kind of provides an example of types of things that you need to check off. You need to show that there's an excellence input resources, innovatives, you look at the R&D activities, and so these are all the criteria that is addressed when they're determining whether a company should be certified as a breakthrough medical device company. Now, these are some of the examples. These are the big companies. We have Lutronic, Samsung Medicine, Seegene, and so these are companies that have been designated or certified as breakthrough medical device company. Again, these are lists of startup type companies who've been certified as such as well. Now, the point that I was going to make was that just because you are a medical device company, a breakthrough medical device company, does that make that all the products that you produce a breakthrough medical devices? That is not the case. So even if you are certified as such company, you would need to go through and identify or be certified whether your device itself could be considered as breakthrough medical devices. The definition of breakthrough medical devices is that basically it needs to provide some sort of significant improvement or expected to provide significant improvement compared to the existing medical device and treatment. And there's been a lot of efforts to promote these type of breakthrough medical devices to enter into market. There's our systems, and a lot of the systems here are very similar to what the FDA has proposed or has been put in place to allow these breakthrough device programs. You could obviously and I'm not going to go into the details of it. I'm just explaining that there are these type of certification that a company could utilize, especially if you're in the digital health industry sectors. These are the products that's been designated or certified at breakthrough medical devices. It ranges from various different types of technology. Some are navigation system. A lot of them are image diagnosis related, partly because that is one of the most advanced area of digital health where you use AI to do it. And so again, this is sort of an example or snapshot of the type of breakthrough medical devices that's currently certified as of early this year. Now, I believe this section would be probably the most, not that I'm trying to pretend that I read other people's mind, but I believe this would be something of interest to a lot of our audience today. And so hopefully I could provide some insight regarding this. This stage is regarding stage 3. The reason that we're jumping from stage 1 to stage 3 is that stage 2 and 4 are typically conducted by HERA. So we try to merge those two together just for explanation purposes. Now, the health technology assessment, what it does is basically you're assessing, looking at the technology. And so if the technology is new medical technology, then it is a subject, or it could be considered for a reimbursement. Now, to be determined or ascertained as a new medical technology, you need to have a lot of supporting documents or supporting evidence. Typically, these are clinical trial. As we've shown in the first slide of today's talk, or first or second slide of today's talk, the stage 3 typically takes about a year, and partly because you need to accumulate a lot of clinical data supporting your technology. Now, if there's a technology that is not quite there to be determined as a medical technology, new medical technology, but we know that there's no safety issue, and we know that such technology has a lot of attributes. For example, it has a technical attribute where it's expected to enhance certain medical output by persons who's using that technology, or that it's a very breakthrough, cutting edge type of technology, it's innovative, or it could provide, has social benefits, or even have a medical benefit as well. So if it falls under, if it's a technology that doesn't quite have a lot of clinical data to support it, but does not have much of a safety issue, so a safety concern, and has meet some of these benefits or attributes, the technical or social or medical attributes, those technologies are considered breakthrough medical technology. And for those, what the government has decided is that they would allow temporary, sort of like a temporary pseudo reimbursement scheme for these type of technologies. So basically it is trying to, you go through, it's sort of like a resurvival, right? So you fail on the competition, but then you get a second chance. Basically it's like a second chance type of scheme where the government is trying to salvage some of the, or be helpful to providing some reimbursement for the certain types of technology that doesn't quite meet the requirements to become a new medical technology. Now, this shows that this entire scheme has been developed partly because we all know, yes, in theory, if the technology is awesome, that's great, but from a company whose main goal is to generate profit and produce products that is beneficial, it needs to make economic sense, right? So if the products can't really be obtained, if it can't be reimbursed or provide additional supplementary monetary compensation, then it doesn't provide much incentive for companies to pursue this type of technology, and that hence the government has proposed this mechanism as well. Now, these are three different types of cases, 3 cases so far who's been identified as such technology, and then a lot of them are currently in review. So they will be in review, or they will be receiving reimbursement from the insurance, but also for the next 5 years, starting from 2019, for the next 5 years, we collect additional clinical data to support. And after this period, if the technology has sufficient enough of evidence showing that there's no safety or health risk or et cetera, side effects, then it might be converted to a new technology and be receiving the reimbursement in the standard procedures. Again, if after 5 years there is not much of a evidence to support this technology, then obviously the project would be terminated. But again, currently there's 3 different types of 3 cases so far who is utilizing this process. Now, this is one of the examples where it's a stomach cancer assay. It is basically in vitro assay where you're assaying 9 different gene expression. And this entire device or product was cleared by the MFDS in 2017. Now, this is the very first case where it's identified or determined as a breakthrough medical technology. So it's currently receiving, if you utilize these products, the company could obtain reimbursement from the insurance company. So this is, again, one example, the very first example that has gone through the process that we just explained. Now, the last part here is related to the, again, obtaining reimbursement scheme and issues. Again, the first couple of slides we'll be discussing about stage 2. It's based on the one of the guidelines I've explained earlier. It's a AI-based medical technology, and for specific for image medical science, you would use this guideline to determine whether your technology would fall under a existing technology or whether it is a more category D or E. So A to C1, these are considered as existing technology. There are some minutia or a very small increment of advancement compared to the existing technology, but it's definitely nothing significant or something that could replace the existing medical service that's been provided. Now, C2 is the part that most people are interested in. So those are technology that's very similar to existing technology, but with a significantly improved accuracy that makes less mistakes than human. So there's definitely advancement or contribution this technology provides in comparison to the existing technology. Now, for C2, although so there's still a jury verdict out there to be determined, and we believe a lot of the companies are trying to, who have been classified as category C2 technology, been trying to, are in discussion with the government to see if this could be subject to as a new medical technology assessment and obtain reimbursement. So, so definitely, if it's a technology regarding C2, there are ways that you could get into communication with the government and do a little dance to see if you could push for a new medical technology assessment. So basically, to go to stage 3. This is related to more pathology. If it's an AI-based medical technology related to pathology, again, same type of concept. If it's a technology concerning if it's designated as category A to C1, it would be typically considered as a similar to although there's some advancement, it is very similar to the pre-existing technology available, and it would be only available for the existing payment. Now, if it's classified as D or E, which provides completely new information, or that was beyond the earlier function of the test, or it could completely replace the existing technology, those would be subject to new technology assessment and move on to stage 3 to obtain reimbursement. Now, again, C2 category technology are the categories that we are currently, that the company would be in a dance with the government agencies to determine whether this could go to the next step, stage 3. Again, a lot of them are, it reduces some errors, significant errors, or improves some of the function and that kind of stuff. So the technology related to that issues. These are sort of an example where we provide where this is from VuNoSmed, and basically for this technology, comparing looking at the growth spurs here and between a X-ray versus the technology, the agency the government has determined that this was very close to the existing technology, and this was not able to move on to stage 3. Now, for this technology, which relates to determining or diagnosing Alzheimer, previously what healthcare professions had relied on was to look at the PET scan image of the amyloid peptide accumulation in the brain. Instead of that, the new technology analyzed the brain waves and then to see if there's any early onset amnesic mild cognitive impairment, which is a precursor or early sign of Alzheimer's. So for this case, what is determined was that it's a new new medical technology. Lastly, if you go on to stage 4, you feel like you've been doing a lot of same type of evaluation, but the last at stage 4, you can get the last evaluation to register to obtain reimbursement. Again, this is a kind of a snapshot as to where once you depending on where you fall under, you might be compensated. You might be eligible for separate compensation. So for example, you could see C2 is very controversial, where C2 technology that's classified as category C2 in stage 2 could be considered as fall under anywhere between level 2 to level 4 during stage 4. So again, if your technology is classified as C2 during stage 2, you could there's ways to see if you could fall under, maybe push it for stage 3 so that you could be eligible for a separate compensation. And again, you know, the standard seems to be a little bit higher for image medical science just because there's a lot more development or advancement in this area of technology. Now, last part is that, and I won't dwell too much into it because we did briefly discuss about these. Telemedicine in Korea is prohibited unless it is provided by healthcare professions. Now that significantly limits the benefit of utilizing telemedicine. And so in that light, the government, and however, if you look at, especially after the COVID, you've seen a dramatic increase in the need of telemedicine, right? So instead of going to a hospital where you could be exposed to COVID and et cetera, you know, they would prefer resorting to other ways to getting healthcare services, right? And one way to get that is through telemedicine. And obviously, US, France, UK, and China, it's a trend that a lot of these countries allow telemedicine so far. And, you know, Korea hasn't been, there's been a lot of push, and there's been bills proposed to amend the Medical Service Act that would allow telemedicine to be allowed in Korea. Now, so far, all of this has not been passed in Congress, but again, this clearly shows that Korean, you know, the government is aware of the need and they're trying to push for it. But again, there are realistic the realities there as well. So again, and this is one of the examples where we discussed the watch in a regulatory sandbox context. And, you know, one of the issue for this watch was that there was an issue related to telemedicine, and whether that it was whether number one, there's a law or statute that existed that prohibited the watch from being on the market, and whether it fell under it. And so again, people have utilized regulatory sandbox to bypass some of these hurdles. Last but not least, there are the last type of products that the industry seems to be interested in is the digital therapeutics. So it's a very novel concept where we understand using digital health in more of a medical device sense makes sense, but actually these are therapeutics, just like drugs or, you know, Tylenol or Advil, right? Something that would be, more makes sense in our more of a older generation perspective is that, you know, using softwares to treat, you know, ADHD patients and et cetera, right? So this makes sense, right? So ADHD patients they have attention deficit disorder, right? So they have difficulty focusing and et cetera. And if there's a treatment and software that helps them focus more, that would obviously fall under a digital treatment type. So again, this is sort of an example that a lot of different countries and different companies have been providing or coming up with digital therapeutics, and there's a specific guidelines for this. And again, you know, there's been articles discussing the need for digital therapeutics in Korea as well. And so, thank you. I know I kind of zoomed through a lot of dense material. We would provide you this this presentation, which would be available with the webinar recording, and so that people could take a look at it at their own leisures. So I would open this up to if there's any questions or answers, please let us know. If not, if you're too shy, I know a lot of us are, and so please, you could email directly, if you have questions as well. Well, thank you so much for listening to such a long or dense material. Hopefully I haven't made you go to sleep and etc. But again, thank you, Georgia, for putting this seminar together. And I would it could proceed to the next panel discussion if there isn't any questions.
Yeah, please. Thank you so much, Christine. That was incredibly insightful. It would be great. We can proceed to the panel discussion now. I think we don't have any Q&A yet.
Sure. Okay, so it's me again. I'm the moderator. And so today we have a wonderful panel, leaders in the digital health area in Korea and APAC. So I would, without further ado, I would introduce Dr. Sang-Soo Kim, SS Lee, sorry. He's a senior healthcare economics and government affairs director at Medtronic North Asia, covering both Korea and Japan. Also the chair of APEC Med Market Access Working Group, also chair of the KMDI DIA Reimbursement Committee. Next, I have Mr. Jong-bae Kim, JB Kim, who is the head of health economics and market access at Johnson & Johnson in Korea. Then we have Mr. Matt Jung, who's the director of global sales and marketing at Vuno. And last but not least, Ms. Roberta Sano, manager and at the digital health director at APEC Med. Again, these are leaders in this field, and so it would be a privilege to discuss some of the points that has been raised during our presentation, and also issue germane to the digital health. We have some questions for the panelists, and so the next 25 minutes would be, or 20 plus minutes, well, I'll ask questions, and the panelists who have, could answer these questions. The first question is that, what are some of the strategies that business should consider for evidence generation that meets the needs of the regulatory, HTA, and reimbursement coverage requirements? And also, do you see what is the biggest barrier amongst the three that mentioned? SS, would you like to take?
Okay, thank you. Yeah, first of all, I want to thank you, Christina, for this very comprehensive presentation. It's remarkable because she tackled from the regulatory affairs, HTA, the reimbursement, and the legislation recently made to boost the medical technology industry. It's kind of the phenomenal some women in Korea. And as Chris mentioned that recently Kim and Jang set up this digital health team with a bunch of some expertise. And from my side, I'm working for the Medtronic, but I assume that Kim and Jang is a good partner, business partner for the legal and the market access, the strategy development. Thank you. And also back to your question. First of all, I want to say that we need to understand. We must understand the evidence requirement is so different and distinct among the regulatory affairs, HTA, and reimbursement. Without those kind of recognitions, we met the kind of manufacturers, the medical device industry, will be in the big troubles. So for strategically for the developing the evidence generations, to the streamline the market access perspective. First of all, we have to think about what specific requirement is that we have to satisfy to individual step among the regulatory affairs, the HTA, and the reimbursement. In general, the regulatory affairs, the evidence requirement is quite generous. It's not much the specific, the robust compared to the reimbursement HTA. I can say that in Korea, the HTA is the biggest hurdles. That's kind of the general consensus among the industry group and the healthcare providers. So for the evidence development purpose, I would recommend to review the requirement first in the regulation and legislation. Second, you have to reach out to the agents in dealing with particularly HTA and the reimbursement. There are the free pre-consultation the services provided NECA and the HERA, so you can get a better understanding about what they want. And also you have to think about the diversity of the medical technologies. So particularly today we talk about the digital health technologies, but nonetheless, there's no specific the dedicated evidence requirement for the digital health, just overarching evidence requirements. So without any pre-consultation process, you may be in a big trouble in the late stages. I haven't witnessed those kind of the tragedy, particularly to the startup company in Korea. So you need to reach out in the early stages as much as you can for the pre-market, pre-consultation opportunity. Last thing is that, particularly about HTA, you need to get the consultation from the healthcare providers. Through the HTA process, the healthcare provider is kind of reviewers and kind of the decision makers for the technology is the safe and effective, good enough for the patient. So collectively, you have to reach out, and some part you have a big trouble. You need to kind of use the consulting fund. They can help reaching out to the right so decision maker, right some commentator and the reviewer. That's my thinking. Thank you.
Thank you, SS. That was great. I believe UNO has just gone through the similar type of process, and I just as it explained. Matt, would you care to kind of provide an example and so that the audience understands what are the types of work that's entailed, and what and the effect and what type of path that you would look to leverage and the steps towards patient access?
Sure.
Yeah, go ahead. Yeah.
I think you're asking me, right, Chris?
Yes, Matt. Yes.
Yeah. Yes. First of all, Chris, thank you very much for your great presentation. It's a really super insightful. I hope with your presentation, what I'm trying to answer your quite loaded questions make sense to the audiences. So to your question, even though the Breakthrough Medical Device Act was established, and then despite the fact that a device is recognized as breakthrough medical devices, and there is no specific benefits with respect to the reimbursement. Currently, the Breakthrough Medical Device Act and the recognition as breakthrough medical devices are not connected to each other. They are managed under different government bodies. What I mean by that, the breakthrough medical device recognition is granted by MFDA for the technology, like really technology intensive products such as IT, robotics, and so on and so forth. Whereas the Breakthrough Medical Device Act is for the clinical practice, not the medical device itself. The practice that uses that MDFS approved device, and it is assessed and implemented by NECA, NECA, National Evidence-Based Healthcare Collaborating Agency. So for the innovative and promising technology, NECA grants the special condition using the Act, condition in which the classified device is allowed to be used in that specific clinical practice to be able to gather as much clinical evidence as possible with the temporary reimbursement code to really incentivize the product use in the market. I believe as of June 2021, MDFS has appointed 8 AI products as the breakthrough medical devices. Luckily 2 of which are our Vuno products. However, none of which was classified as the new or breakthrough medical technology under the Breakthrough Medical Device Act by NECA, and accordingly permitted to be used with the temporary reimbursements to build clinical evidence, and moves to the next milestone, ultimately for the goal, which is a reimbursement evaluation by HERA. I know it's a quite complex process because a similar assessment is done and implemented by different bodies, but it is all about the getting new reimbursement code to new devices. So try to speak more about the process of granting the new reimbursement code to AI medical devices more specifically, even though Chris, you did great job, like, just laying out all the the specific processes, but the HERA is evaluating the MDFS appointed breakthrough medical devices to see whether the practice with the technology being used is already existing or new. So it's old or new. If HERA says the practice with the AI technology as a brand new one, NECA with the Breakthrough Medical Device Act classifies the AI technology for the new practice into the new or breakthrough medical technology category and allow it to be used in a real case uses with a temporal reimbursement code to build the clinical evidence. Now, really, for example, with our Vuno case, we have Fundus AI. I know Chris talked a little bit about our, another product that is a bone age, but let me, give example with the other product that is Fundus AI. The Fundus AI is to detect 12 retinal abnormalities from the fundus images taken from the fundus camera for major eye diseases, including diabetic retinopathy, which can really lead to blindness of patients if not only detected or properly treated. Our AI, Fundus AI product really helps ophthalmologists not to miss anything and saves time because ours can do that exam within seconds, really like 3 seconds and 4 seconds. Also, it helps non-ophthalmologists such as primary care doctor or endocrinologist, who don't necessarily have enough skill sets to do the fundus exam. To really be able to comply with the clinical guideline, which in turn drive the fundus examination and screen rates. That is really a key driver to prevent blindness, patients with early detection and timely treatment intervention. That is really substantial. But, the HERA said doctors have been already doing the fundus exam. Yes, that's true. And they can do without AI health. That's also true. I would argue that which is yes or no, or maybe it's really depending on which doctors they are talking about. Anyway, their answer is, we cannot classify your device into the breakthrough or new medical technology category, which means that we cannot have the new reimbursement for for our product, which is a huge barrier for the mass adoption of our product. So, by the way, however, we have continued to voice our concerns and challenges to the government bodies, and really, given the situations, and we believe that okay, this is really the challenges we have. This is government policy, and I know the SS talked about these challenges before, and what we need to do, from our private company or public company end. But we are very determined that we need to be more strategic about the product development from early concept phase by designing the product that is able to provide the new clinical information and be able to replace the existing expensive clinical practice and having clinical evidence to show. Or really so as to be classified into the new breakthrough medical technology category by NECA. So like, as I said before, NECA really requires the companies to have the literature about the product that really proves the efficacy for the category. And we need to make this effort early on from the product concept stage. We've been working on 2 particular specific product. The one is a different AD that diagnosed dementia using MRI images, and deep cards that predicts patients' heart failure and arrest using biosignal. You're really predicting patients like, what is the probability of a patient having the heart failure within 24 and 72 hours. This is what we have been striving for in a very proactive way to fully utilize the regulatory process and rules already set up. I know this is really a long answer to your short questions, and apologize for that, but this is what we really experiencing, and then this is really what we're trying to overcome the barriers.
Thank you, Matt. That was a wonderful answer to my very short and ignorant question. So I really appreciate your answer. And again, I mean, we as an audience who haven't done this at firsthand, that sharing your experience is immensely helpful. And I mean, to your point, to that fact that even at a product development stage, that one would need to consider these processes and find a way to kind of classify or characterize your product as something that's very different or novel that compared to your existing technology. I think that is a very insightful comment from people who would be a lot of designing their products and etc. So thank you so much, Matt. Next question would be, so this is so it relates to how do you think an industry would better leverage the innovative HTA track designed by NECA, since both SS and Matt has been explaining the importance of NECA and what NECA actually does. And I think I would, if possible, would JB answer this question?
Yeah, sure. Thank you for your presentation, introduction, and question. I'm very honored to be here, and many of the information shared by you already, and I would like to talk some point. Access to innovative medical technology is really exciting for everyone. Manufacturers and patients who will benefit must be more excited and looking forward to its access as soon as possible. However, when it comes, regulators and medical professionals want to make sure of its safety and effectiveness, because as we all know, it is directly related to the patient care. Some legal experts also have their opinion that it is not easy to be eligible as a potential innovative technology due to precondition is safety. However, they say it can contribute to provide better care for patients and promote medical device industry for their input and growth. New technology should consider HTA process with high importance. We call this is second hurdle after product registration. Finally, after pass this hurdle, a reimbursement hurdle would follow, as you know. Digital health technology is an innovative technology worldwide and not easy to generate the evidence required to successfully pass HTA process. So Korean government announced the innovative HTA track in July 2018 to enable fast access. We call the innovative technology HTA track. And it was implemented in March 2019. We need to think how we can leverage this special track for digital health solution. First, what kind of factor can help to be selected this track? Typically, NECA would perform systematic review for a new technology in the standard HTA track. However, for digital health solution technology, it is hard to create evidence and track and regular research due to too fast to develop to create adequate evidence. Therefore, now NECA started considering the potential of technology as an additional factor. So we needed to prove the potential of technology for digital health solution, such as technical, social, and medical perspective. And it will be linked with patient healthcare improvement finally. Second, we have to consider the eligibility of breakthrough medical technology. Especially, we needed to focus on the high-weighted evaluation criteria by committee NECA. Use of breakthrough or cutting-edge technology, such as robot, 3D printing, implantable device, nanotech, AI, and etc. And the disease with high demand in society, such as cancer, heart disease, or rare disease. And the absence of alternative technology also allocated double points compared to other items. We should leverage on this. Third, we have to anticipate long-term and prepare re-evaluation of our technology, because NECA will perform a review after 5 years of approval date. We should report the clinical evidence on the effectiveness of the technology and create clinical evidence during this period. In my opinion, there are 3 key points that policymakers can consider to improve patient access to new digital health technology. Due to the time limit, I will firstly point out the first one is the evidence generation is for this technology. This activity is very resource intensive. So most of these companies are small and in the startup stage. So Korean government have to support this area to boost technology. The second one is the more flexible standard application for the NECA review. Actually, everybody want to create a high standard of research to prove their technology. However, it is not easy. So Korean government wanted to consider this. And the last one is the more flexible reimbursement application. Developers, usually medical device companies, definitely they need to secure their fund to recover and reinvest for the improving and other more advanced product development. I would like to conclude with this. The digital health technology could benefit from the fast track HTA process. So, but the current methodology is still limited in the practice to encourage more access to these innovation. Okay, that's my side. Thank you.
Thank you, JB. I mean, I love that you have isolated and packaged into the 3 points that you want to message to the audience. And I think, you know, hopefully some of the government officials were joining. I don't know who's actually listening to us. Hopefully this would trickle back into the NECA or MFDS, and hopefully so that it would, you know, as you said, that they could approach this with more flexibility and provide, you know, more realistic solutions for companies who are trying to provide innovative solutions to the patient. So thank you so much. Because of time, we are going to go to, we're going to go to, hopefully, you know, it won't take too much time. But the next question concerns that from the APAC Med, since APAC Med is sponsoring this event, how do you think that it could work that APAC Med is going to do in the region, or what type of work that APAC Med could provide in Korea to be leveraged, and so any kind of support from APAC Med? So I would like to address this question to Roberta, please.
Thanks, Christine. Thanks for the question. I'll try to be very concise, but I wanted to thank all the panelists, because I think all of the topics that you guys shared with you today are really the strategic topics for APAC Med, for our members, for all of the healthcare stakeholders when it comes to digital health. So really thank you for that. In a nutshell, let me share what we are doing when it comes to regulatory healthcare technology assessment and reimbursement of these new digital health technologies in the region, and now this, you know, it's translated in the Korean environment. So from a regulatory perspective, we have already a position that we published in a paper. This position paper was originally including Japan, Australia, and Singapore, and now we are writing a new paper that includes Korea. So we know, and we are discussing with the regulators as well in Korea. So what we hope to do as a next step is to collaborate even more with regulators in order to provide some recommendation to better look at regulatory for these new technologies and provide more access of, you know, life-saving solutions for patients. And then when it comes to reimbursement, I think Korea is really an interesting example for us, because it's one of the very few countries worldwide to have an health technology assessment framework for digital health. So I think, yeah, that's in a nutshell what I wanted to share. Given the time, maybe I will hand over to you, Chris, or for the closing remarks. And feel free to contact us if you need more information about our work in Korea. Thanks.
You're on mute, Chris.
Sorry. Thank you so much, Roberta, and apologies for the short, time period. Just as right before I go to the closing remark, SS and Matt, I know you guys are the leader at the KMDIA. Any additional remarks added to what Roberta has just explained?
You want to go first?
Yeah. Due to the time constraint, I want to shortly remark. Christine, as you presented about the government initiative about the pre-market post-product evaluation, KMDI want to extend the initiative covering to the digital health and the medical device sector. That's the initiative, and we are now keep the driving force right now. Thank you.
JB?
Matt?
Or Matt, sorry.
Sorry, I was on mute. Just like I spoke about before, the major challenge barrier is the disconnection between just being recognized as a breakthrough medical device under MFS and being classified as the new breakthrough medical technology by NECA. I think the solution for the time being is for the private company, public company, industry be more proactive, and at the same time really try to figure out the what they need and what kind of solution we need to provide. At the same time, just probably might want to move early on from the product development stage to be more satisfying the government regulations so that we can accomplish what we want. In this case, just the reimbursement code for mass adoptions, and then just the utilizing this time. I want to say thank you very much for KMDIA. I know you have been doing great deal of work for Korea innovative digital healthcare solutions, and to be able to grow globally. And yes, I want to say thank you, and I really appreciate your work. Thank you.
Thank you, Matt, and thank you, SS. It was, and everyone else, JB, Roberta, and Georgia, thank you so much for, being here today, providing insights to the audience, and also educating me, as, so much to learn from practitioners. And, I'm on this little ivory tower over here, thinking things at a more abstract term. But again, thank you so much. The closing remark is, again, thank you for joining in. We had a lot of people participating or listening into today's talk. Last points are going to be that yes, there are realistical hurdles, but the government is trying to expand and assist companies to provide their digital health solutions to the patients. APAC is doing their thing to support region and as well as Korea. Again, KMDIA is also doing their thing. And thank you so much, SS, for the present, for the pre-market post product approval. Again, so thank you again for being here. I know we're 4 minutes of past, but thank you so much. And hopefully we could meet again, maybe in person or virtually. Thank you so much. Have a wonderful day.
Thank you so much, Christine. And again, on behalf of APAC Med, a huge thank you, everyone, for joining us. And we look forward to continuing this discussion through APAC Med's 2021 Digital Health Series. We'll be holding a digital health policy dialogue at the end of July. KMDIA is involved. We very much appreciate this partnership. So we look forward to keeping you updated on our collaborative work in this space. I'm sorry we didn't have a chance to answer questions, but those questions that were posted, we will follow up with over email. Thanks again, everyone. Have a great day ahead.
Thank you. Bye.
Thank you.
Thank you.
Take care.